Welcome, everyone. Thank you for joining us to learn about cervical screening. This presentation has been prepared and is presented by the Health Promotion Team at Women's Health Loddon Mallee and the Deaf Hub Bendigo, in partnership with the City of Greater Bendigo. The information presented here is factually correct and up to date at time of publication. Please regularly check recommended resources and references for any updates or changes. Women's Health Loddon Mallee acknowledges the traditional custodians of the lands on which we live, work and play. We celebrate and respect the unique cultural and spiritual relationship that Aboriginal and Torres Strait Islander peoples share with the lands, sky and waters, and the ongoing contribution their cultures make to the life of the region. As we pay our respects to elders past, present and future, we pledge our commitment towards reconciliation and justice. We recognise the strength and resilience of all Aboriginal and Torres Strait Islander peoples and are dedicated to a future in which they feel connected, empowered, and safe within the communities of the Loddon Mallee region. Women's Health Loddon Mallee acknowledge the ongoing advocacy and resilience of LGBTIQ+ rights movements and stand with them in solidarity. Through our programs, policies, and practices, we are committed to addressing the structural and social barriers to health, well-being, and inclusion that LGBTIQ+ communities continue to face. We are guided collectively by the unique and different ways in which LGBTIQ+ communities experience gender and identity discrimination and continue to listen, reflect, and learn as we evolve our approach to ensure greater equity and inclusion across the Loddon Mallee region. My name is Catherine. I'm a Health Promotion Officer at Women's Health Loddon Mallee. I work in the area of sexual and reproductive health and am passionate about equipping people with information that can keep them well, improve their quality of life, and navigate healthcare services. Beside me is Elise, our women's health nurse at Women's Health Loddon Mallee, who specialises in sexual and reproductive health. Elise is also a nurse counsellor at Breast Screen Victoria Bendigo. Elise has worked at both organisations for over 10 years, so many years of experience in women's health and cancer screening. Here is a photo of our office front in Myers Street, Bendigo, where our Well Women's Clinic and Pregnancy Choices Clinic are located. Today we will discuss cancer prevention through cancer screening, cervical screening options including self-collection, booking your cervical screening test, receiving your results, and resources. One of the best ways you can look after yourself and protect yourself from developing cervical cancer is by having a cervical screening test. This was formerly known as the pap smear test. In fact, cervical cancer is one of the most preventable cancers. Depending on your medical history and whether your result returns as normal, your cervical screening test is usually only required just once every 5 years. The virus that causes almost all cases of cervical cancer, the human papillomavirus, can be detected with a cervical screening test. The human papillomavirus, also known as HPV, is a common infection. Most people don't even realize they have it, and it usually clears up on its own. Sometimes, if it doesn't clear up, an HPV infection can cause cell changes in the cervix, which can develop into cancer. These changes can be monitored or treated if HPV is detected early with a cervical screening test. You may have heard of HPV before in relation to the HPV vaccine. In addition to cervical screening, the HPV vaccine is our greatest tool in the prevention of cervical cancer. The vaccine is most effective when given to adolescent boys and girls before they become sexually active. The recommended age is 12 to 13 years. In Victoria, the HPV vaccine is available for free to all adolescents in Year 7 of secondary school, aged 12 to 13 years, through the National Cervical Screening Program. Over 70% of people who get cervical cancer in Australia have never been screened or haven't been screened regularly. So, your best protection is to have cervical screening tests, even if you've had the HPV vaccine. The vaccine protects against some, but not all types of HPV that can lead to cervical cancer. There are lots of reasons people may be putting off getting their cervical screening test. These might include not knowing where to get the test, they think the test might be uncomfortable or embarrassing, they might have had a bad previous experience, medical or otherwise, they're too busy to prioritize a health procedure, they're scared of what the test result might be, they don't have a nurse or doctor they feel comfortable with. Having a doctor or nurse you feel comfortable with is really important. Some people may feel more comfortable with a female doctor or nurse. You can call 13 11 20 or email cis@cancervic.org.au to talk with someone from Cancer Council who can assist in finding a female doctor or nurse that provides cervical screening. So, is it time for you to book your cervical screening test? If you're a woman or a person with a cervix, if you're between 25 and 74 years old, if you've ever had any type of sexual activity, and even if you've had the HPV vaccine, then you should have your cervical screening test every 5 years to protect yourself from cervical cancer. When it comes to collecting a cervical screening test, you have two options. The first option is a clinician collected specimen. The doctor or nurse will use an instrument called a speculum to gently open the vagina and collect the specimen using a small brush. The second option is to do it yourself using a simple swab. This is called self-collection, and it's available to most people due for their cervical screening test. If you choose to self-collect, you'll have support from your healthcare provider to make sure you understand what to do, that you feel safe and comfortable, and that you have enough privacy. Talk to your healthcare provider about which option is best for you. Both are an equally safe and accurate way of testing for the HPV virus. Your results will be available in approximately 2 weeks' time. You'll receive your results via a letter. Your sample will be sent to a lab so they can test it for HPV. If they don't find HPV, your next cervical screening test will be due in 5 years. If your test results show HPV, your healthcare provider will let you know via phone or communication method of your choice. You may be asked to return or see a specialist for further testing. To get a cervical screening test, you'll need to make an appointment with your healthcare provider. Lots of people go to their doctor for their appointment, but there are also other options, like women's health clinics, community health, and Aboriginal health services. The National Cancer Screening Register will send you a reminder letter when you are due to screen. You can also ask your healthcare provider when you're due, or you can check the register through your MyGov account. Check out www.health.gov.au/NCSP for more information about the National Cervical Screening Program. Here are a list of resources you might find helpful to learn more about cervical screening. The National Relay Service is also listed here. A call through to the National Relay Service lets you communicate with a hearing person who is using a phone even if you can't hear or don't use your voice. The National Relay Service has specially trained staff called relay officers who can help with every call. Depending on the type of call, a relay officer will change voice to text or text to voice and Auslan to English or English to Auslan. For further information on the National Relay Service, search the link provided. This concludes our presentation on cervical screening. Thank you.